Please make sure to listen to the disclaimer at the end of this episode. This is the Suburban Folk Podcast, Episode 8, dealing with repetitive exercise injuries and marathon training with Andy and Will from the DIYTherapy Podcast.
I'm looking forward to having some real talk with some real folks.
Hey, this is Greg with the Suburban Folk Podcast. My guests today are Andy and Will from DIYTherapy Podcast. How you guys doing?
Good. Very good. Thank you for having us.
Oh, absolutely. Thanks for taking the time. I came across you guys some weeks back through social media, and at the same time that I was doing... yeah, actually, it seems like our movie tastes and other stuff like that are about in sync, and I'm pretty sure even for kids and other stuff, we all
kind of line up,
we're facing the same challenges. So when I listened to you guys, it sounded very familiar as far as some of the day-to-day things that you have going on. And as luck would have it, the first episode I listened to was shin splints, and believe it or not, I was actually running when I was doing that, which was pretty interesting. And then the very next episode you guys did was on injuries from repetitive exercises. And when I completed my triathlon episode, folks that I knew started to say, so when are you doing the triathlon? And I have a background in long distance running. So they said, oh, are you going to try and PR in running? And I've never met a challenge that I haven't liked. So it made sense to me to get out ahead of the injuries that I'm inevitably going to face and bring you guys on to talk about some of those things and maybe what I can watch out for. Plus, I like the fact that it's DIY therapy because I'm the typical guy that there's got to be a lot going on for me to go to the doctor or to a physical therapist or anything like that. So I can use some of the tips to pretend like everything's okay and then, sneak away into a closet or something like that and try some of the stuff that you guys suggest and pretend that nothing's wrong at all. So I think that's pretty cool concept as well. But before we got into some of that, what is the history for you guys as far as when did you decide to do a podcast? What were you listening to when you got interested in it? How's it gone up to this point?
How's it gone?
As far as podcasting is concerned, when you started? And
it's certainly a learning curve because neither one of us are technically
sound.
Yes, when it comes to computers and all that stuff. So there was a big learning curve on that. There's a learning curve on, especially for ours, we're kind of a niche podcast. There's not a whole lot. People will like. I have shin splints. I'm going to listen to this specific one episode. And so, trying to maintain an audience base is a little bit not tricky, but it's
challenging. Yeah. But I mean, like a little bit of history behind us. We're both physical therapists. We actually decided we were working together, and we just from a personality standpoint really hit it off. And from treatment philosophy standpoints, we really hit it off. I had started my own business with a low back pain product. And at that point in time, Will kind of came on and we just kind of discussing how we could continue to kind of expand the business. And since then, Will has become pretty much a full-time partner with me in regards to trying to grow, our reach and really try to just kind of help other individuals get through simple strains, pains, aches. Like you were kind of alluding to, the majority of individuals, will have some type of ache or pain, but they won't go to the doctor. And so how can they get through that whole process, whether it is a shin splint, whether it's back pain, whether it's neck pain, whatever it is, how can they get through that whole process more quickly? And so, we're really ortho-based, musculoskeletal based.
Yeah, you have to explain what ortho-based means.
So really sure. Bones, joints, low back, neck, we're both active also.
Yeah. So when you see ortho, it's like people tend to think of just like the orthopedist. It's the same way with physical therapists. We delineate between people who people kind of like specialize into like neurological, so like strokes and whatnot like that. And then and ortho is kind of like the rest almost. It's like not quite a catch-all, but it's
kind of though.
Yeah.
Yeah. In terms, we deal with people who are, elderly, have balance issues, deconditioned, all the way to that high level athlete.
Yeah.
So, and also all the way into the peds. So, children.
Peds, yeah.
Sorry. I tend to talk very technical, and Will kind of is good about dumbing it down. So,
are you saying I'm dumb?
I am not saying you're dumb.
I'm saying I'm dumb.
Okay, all right, you're dumb.
Well, actually, luckily for me, my wife happens to be a physician. So even the term peds, I think before knowing her, I'd be like, what is that? But pediatrician. So I'm tracking with you, but I hear you. Sometimes you get into the acronyms and you assume people know what you're talking about and may not necessarily be the case.
Yep, absolutely.
So the podcast is an extension of what you guys are doing as far as certain products that you're offering. And I even noticed, for example, with, I think it was after the marathon episode that you had some recommendations on like the knee bands and things like that. So that's sort of part of the package of
part of
what
it.
You guys do.
We started off more as just like an educational because we're big on education.
Yeah.
Mm-hmm.
So it kind of goes back to there's really kind of a change in how rehab specialists are starting to treat people. It used to be 5, 10, 15 years ago that we were really about just fixing a problem.
Mm-hmm.
And so our philosophies, both and this is due to research experience, but our philosophies have really changed from, hey, what is your diagnosis? What is specifically going on with your body to, more or less, what can we do to help kind of take away some of those irritants, some of those agitations in your daily routine? What role do you play in your pain? Kind of go into a deep dive in terms of, kind of a self journey of what it is that's actually agitating those issues. And be more of a facilitator versus a fixer. And that's kind of the way that all rehab specialists are trending at this point. There's always kind of some trends that go along within industries, but this is kind of where I think you're going to see most rehab specialists move towards. We'd like to think that we're kind of on the beginning edge of it, whereas there are some facilities that really look, or rehab specialists that still look at just fixing that underlying problem. But the truth is that there isn't a lot of correlation to just a specific dysfunction in pain. Pain is much more complicated. And so we really try to help individuals understand what all the variables are that are going into that pain, whether it is something like shin splints or whatnot. And then also, the products, as you kind of asked, the products that we have kind of recommended moving forward are really more of an adjunct type of treatment option.
We wanted to find ones that are specifically we knew were good.
Yeah, and will help people and help push people along through that whole healing process, because there isn't a quick fix. We're kind of in this society where everybody wants to kind of line up, take a pill, and or
talk to my mom about that last night,
or just get have surgery or whatnot. How do I get that quick fix? And it's not indicative of the people who want that. It's not because they're bad people. It's just that's what it's where we are as a society.
Literally, I mean, we're all roughly probably in the or late 30s and stuff like that. So we all remember. All of us remember back when, if we wanted to watch a movie or even a show, you had to wait for it to come out on DVD or VHS or whatever. Now, literally everything is dropped in your lap and you have access to everything at all times.
Yeah, and unfortunately, that has bled over to the healthcare system.
I mean, it was always bad. It was bad, but I feel like it's getting not really worse, but it's ticking up, I feel.
Yeah, and I think the other thing is, one of the big pushes for the podcast we've created is that we feel like there are so many options that people aren't aware of that can really help them, that can have a really large impact on their pain very quickly.
It's very simple, and it's simple stuff.
Yeah, I mean,
you don't need to go and get like a 20-minute exercise routine necessarily.
Mm-hmm. I still practice, working one-on-one, face-to-face with patients, and at the end of the day, a lot of times people go, "Well, that was really simple. I can't believe all that worked." And that's really what we're about: is simple solutions to what some people think are complex problems, but really aren't.
I mean, sometimes it is a complex problem, but the solution isn't necessarily that.
It's not rocket science.
No, that's kind of where we're coming from. It's like I have back pain. Well, let's try this one thing.
Yeah. Yeah, and I think sticking with the knee band example, that was something that I dealt with in the first marathon that I ran. And prior to doing any research, I probably would have gone with like the sleeve versus just the small band. Because I don't know, I thought of basketball players that you see that would wear them and didn't know anything about. And you guys talked about the patella and work for me. So I know during my research for whatever activity it is helpful to have somebody that's doing it day to day to say, yeah, try this first at least. You can wade through some of the bad options, whether it's something that looks too good to be true, or like you said, keep it simple and don't do something major when there might be a quicker fix.
Absolutely.
So transitioning to the marathon part, Will, you talked about
it wasn't
running.
Me, it was Andy.
Oh, it was Andy that ran it. Okay, I'm sorry.
No, it's fine.
So it sounds like the training plan was pretty quick then, and
training plan I believe is generous.
Yeah.
Yeah. So I think a little background probably is needed here.
Sure.
So I am 36. 3 years ago, I ran a marathon, and not by choice, but by.
I feel like you had some say in the matter.
Okay, so here's how this went. Right, I am I have been fit my entire life. I'm no longer fit. I played soccer in college, and I would say that I was actually a fairly decent soccer player, but not because I had any skill, but because I just was naturally very fit, could run forever. Mm-hmm. And so over the years, after my wife and I had a couple of kids, my son would not go back to sleep when he was about 2.5 years old. And so I would actually wake up at 3:30, 4 o'clock, and I'd run him in the stroller. I made the offhand comment to my wife that, gosh, I'm running so much I could practically run a marathon.
Right.
And it goes back to my wife, who is actually very fit and was about 2 weeks out from running her first marathon, where
mm-hmm.
she all of a sudden had IT band issues, bursitis in the hip, etc. And she had to actually pull out and not complete it. And it's been one of her kind of lifelong dreams to do so. And she said, well, you can't run a marathon. And I said, what? Absolutely, I can run a marathon. And that's where the problem started.
Right.
Yeah. And so from there, she said, well, okay, you could, but you don't have the time to train for it. And then, of course, I dig deeper and I say, well, who needs to train for a marathon?
I feel like that's not necessarily digging deeper. It's pulling the dirt over the top of you.
Yeah, definitely loading your own gun right there. But so from there, she said, okay, well, go ahead and do it. And I said, all right, I shall. And we kind of established these rules where, like I said, I was running at the time, but I wasn't allowed to run any more than what I was already running. So I was running maybe 3-4 times a week, maybe 30 to 45 minutes at a time, maximum of maybe 6-7 miles per session. But that was very irregular also. So typically it was about 3 or 4 miles that I was running at a time. And that's what I continued to do all the way up until the marathon. I then proceeded to mock my wife even more by not tying my shoes during the marathon, having a giant cup of coffee right before the marathon.
I didn't know you didn't tie your shoes.
Yeah, my shoes were never tied. Yeah.
Wow.
My shoes were never tied. My cousin actually came in from Oklahoma to run it with me. He had a whole bunch of friends that he brought with him too, and they all mocked me the night before when we were carb loading the night before, and they didn't realize that I hadn't been training, and they were all taking bets over and under on when I would crash. And then I proceeded to go out of the gates, and within the first half marathon, the halfway point, I was at 1:28.
Wow.
Yeah, I was at a ridiculous pace and feeling terrible. Because what is that? At that point, that's 13.1, right?
13.1. That's right.
Yeah. So continued down that path for a bit, and then the last 7 miles were just not good in any regard. I mean, my bones were hurting. I could feel every every step. In fact, I remember getting to about the 23-mile point, and my kids are out there with signs and everything, and they're like, "Yay, Dad!" And my wife's like, "It's all downhill from here." And I'm like, "No, downhill's not good at this point because I can't. Like, uphill's better because all the pounding going downhill." So, anyways, I did end up finishing at about 3:45, which I was pleased with, but I could not move for the next month. Legitimately, the next month, I had trouble going downstairs for a week. I actually didn't even take the day off the next day, and I couldn't wear shoes the next day when I was in the clinic. It was. I won the battle, but I lost the war, is what I always tell people.
Specifics around the training plan. So how many weeks or months were there when you were doing sort of the off cycle runs that were probably not the distance that you wanted to be doing? Was that for 2 months, 3 months leading up to it? Or was there less time? You just sort of had to get in what you could?
Well, I was at that point running just consistently. So that was kind of the rule, was I wasn't going to increase any of my running. So, I mean, I think we made the bet in early June, and then it was mid-October when the marathon was. So,
okay.
But my training didn't change at all, and it wasn't as if I was. I would say the one thing I did do differently was towards the end, I started increasing my pace significantly, but that was about it. Yeah, that was about it.
Would you recommend this to?
No, this is a terrible idea.
Okay.
Yeah, on every level.
Yeah, and I actually was very much the opposite for the first marathon I did. I didn't consult any marathon training schedules. I just said, okay, if I add an extra mile to my long run over the weekends, then I'm going to hit 20 miles, something like 6 or 7 weeks out from the marathon. And then I know I'll be able to run it. So I basically was set to run 20 plus miles for a month and a half before I got into the marathon, which was not good. Luckily, the first time I ran a 20 miler, I thought I blew my knees out. When I was done and, getting showered and cleaned up, I could barely feel them. It was very creaky for quite a while. So I had to pull back just from risking injury at that point. And then my marathon, I was just beat up at that point. So I ran like a 3:55 for the first one. I was just wanting to be under 4 hours, but very much the other way. And the other stupid thing I did, I pulled it off. So it's kind of a nice talking point. I was playing in bands at the time. So I sent an email to the people running the race and said, "Hey, could my band play at the finish line?
Oh, no.
And wouldn't it be cool for me to?"
You're going to you have to finish and then jump in the band?
Yeah, exactly. And I thought they were going to say, "No, we don't even know if you can finish a marathon. Why would we, allow the prime spot?" Not only did they say I could, they actually did a feature article on me in the local paper. And so I'm like, oh man, I am in now. I am committed. So yeah, I took like 20 minutes to sort of stretch, but then I played guitar for like an hour, which wow, yeah, stiffened up. It was
good for you.
Yeah, you're good. I mean, smart life choices is always a good thing.
Yeah, exactly. So you live and learn, I guess. Cool story, but similar. I was miserable for the next week and a half. I think I had to go play golf a couple days later. And if I kept walking, it was all right. But if I had to stop or sit down, I was a mess. Yeah. So
how many of you ran now, Greg?
Actually, only 2 marathons, about 8 half marathons. So. Okay. The half marathon I treat kind of like you're saying for the marathon. I can pretty much run that whenever, sure. Even if I'm not in a regular training plan. But for the marathon itself, obviously needs a little bit more focus. And I've signed up for a running group at this point over the winter for a marathon that's in March. And the other thing I said for the last one I did is I was a 3:24. So I did much, much better with my second marathon. So I was like, oh man, this is so dangerously close to Boston qualifying, once you get into those higher levels. So I was like, all right, if I'm going to do another one, might as well give it a shot. So I figure maybe the training group will be the thing to get me over the hump. Now I just read that they've decreased the times by 5 minutes. So
oh, really?
Yeah. So it would have been for my age group 3:10. Now it's back down to 3:05 again. Yeah. So we'll see what happens. The training guy said, well, it's not impossible, but getting that 20-minute time reduction is going to take some work on your part. So
that's great.
We'll see how it goes.
So you've changed your training patterns, I'm assuming, so that you're not running those big long runs a month and a half out, correct? So you've kind of timed it better, I'm assuming, because that's kind of the goal for most of those. If you look at, and you can get some, as you know, you can get some basic training schedules out there, but the goal is to peak about that week and a half out or so prior to the marathon. So that would be the one thing that I think you probably changed.
Oh, for sure. Yeah, the tapering, you just have to trust that it's going to happen. Because I think most people that do this type of exercise, you have a hard time switching your brain to say that you need to lay off and let your body recover leading up to the race.
I mean, most anybody who's like into a thing is like that, especially runners you tell them they can't run and it's like, I'm not going to not do that.
Well, we become a little obsessive.
Right.
I think it's the big thing. Yeah. And as you know, when we're training like that, it's one of those things where it's like, okay, well, if I actually let off, am I going to lose something? Where the recovery is actually what you need.
Yeah. Yeah. I was going to say you become fit in rest as opposed to the opposite way around.
Mm-hmm.
Agreed. And actually foreshadowing, one of the things I really want to hit from your guys' perspective is what types of injuries can you continue to train through, and what would be some of the signs to say, okay, something's not getting better, whether that's just a time frame of a nagging injury that just doesn't go away or severity of the pain. I'll be very curious to get your guys' perspective on what that looks like and what to be looking for so that you don't do major damage when you're in the middle of training. So I thought maybe if we would, let's say literally from top to bottom for what the typical injuries are, I'm thinking the highest would be probably back pain.
Talking about in terms of running, or are you talking about
for running?
Okay. Yeah. So, I mean, really in terms of running, I don't think back pain, we don't get a ton of.
No.
And partly because, when you really look at like runners and the age brackets that are doing these running, most people have more of a, in this age bracket are going to have more of a disc issue. And when you're running upright, that doesn't really affect the disc too much.
It's almost better for it.
Yeah. Now, the one thing I would say is, there's this in terms of back pain, the one thing that people tend to do right after they run is they stretch out their hammies. Okay, so they're doing all this repetitive flexion, or they're sitting on the ground and they're doing the runner stretch, et cetera, et cetera.
So in this case, flexion is basically bending over and like touching your toes.
Yeah, and so
and flexion is in your back.
So when you are standing or running for a long period of time, that disc will actually become very heated, and then when you go and bend over right afterwards, that you go from all this extension or bending backwards during the running to all of a sudden forward bending very quickly and for static periods. And with that disc really heated, you can actually open yourself up to some susceptibility to injury right then and there.
Yeah, it's like heating up a metal. It's fine, and then you try to bend it. Once it gets to a certain point, you can actually bend it.
Yeah. So if you're gonna so the one thing that I would actually tell a lot of runners that do have back pain, and I find that there are people who do a lot of the hamstring stretch, bending over, those types of things, do it actually on your back. And it's called a 90-90 stretch, but you would just lay on your back, you put your hands behind your knees, you get your hip to about 90 degrees, and then you kick your knee out straight and stretch your hamstrings in that way. And when you're doing it that way, you're actually isolating the hamstrings versus getting any forward bending in the spine, which is what you want to avoid when that disc is super heated like that. So,
and a lot of races, I've noticed they're actually having. I mean, the therapists they have physical therapists will be there. Like,
your marathon, you probably have
so
that.
they'll stretch you out, and I wouldn't necessarily have them stretch your calf because they can't do a very good job of that. But I would stretching your hamstring, having them lay down and stretch your hamstring for you. That would be a good alternative.
Mm-hmm. Yeah. So that's a big thing that we see from the calf. The low back. Sorry.
Yeah. How's it going?
Yep. Real well. But if we're moving down the body, then the next stop is really the hips. And so, there, and I don't know if you've ever experienced this, Greg, but hip bursitis,
hip arthritis.
Some people have hip arthritis.
Some old people.
But hip bursitis is the next big thing, and that's really when there's what's called a bursa sac that sits on the outside of the hip, and there's several different structures that either can start to irritate that bursa sac and or get it inflamed, and so most of the time that's going to be your IT band. For those who are runners out there, they're very familiar with the IT band rolls, IPT band stretches, etc. The other big muscles that are attached to that area, though, are actually your glute medius and then your piriformis muscle. And those should probably be stretched out also. In regard,
and you might have better luck stretching those muscles than you would your IT band, really.
Yeah, actually, the IT band, you're really never going to be stretching. You're going to be more or less stretching the muscle that's attached to it, which is the TFL. But that's another whole nother discussion.
That's a whole, yeah.
But with that being said, there are, you can do some rolls and things like that, and there are some benefits from doing that, especially if you feel like you're getting some relief from that. In regards to what are the signs and symptoms of greater trochanter bursitis, this hip bursitis, this lateral hip pain, all kind of put into one little bucket there. Outside pain, point tenderness, not being able to lay on that spot. I think the big thing with people is really understanding how your body responds to different activities. So it's one thing if, hey, you start walking or you start doing your jogging, you have a little bit of soreness, but you kind of work that out and then you keep running. And then really, what are you doing or what are you experiencing after that run? Okay. So after a training session, are you having hip pain? Does it come on? Does it last for 5-10 minutes, but then go away? Or is it something that's lingering for 20 to 60 plus minutes? When we talk about repetitive stress syndromes, which again is something that we see a lot in runners, this is really more about how long do your symptoms last? If your symptoms are lasting less than 20 minutes, it's usually not a major concern. Okay. If you're waking up in pain, if you're having pain that's lasting that hour plus, then you know that you've probably done too much, and you have to start to look to either alter your training, giving yourself more rest in between, and or in terms of the duration of your current training session, you need to start to actually lessen that, and then look to see, again, for the hip that we just talked about, look to see if what happens when you start to stretch some of those structures and how then that affects the pain following your
and would you say
training
ice?
And of course, ice with any type of repetitive stress syndrome.
But I think with hip bursitis, it is trickier to ice because it's so deep. It's so close to the bone that it's hard, underneath all the muscles and stuff like that. It's kind of hard to get at with the ice, but it's never a bad thing to try.
Yeah, absolutely. Go ahead, Greg.
And as far as the stretches are concerned, would this be before as well as after you get ready for a run? For example, I definitely subscribe to active stretching, which I think just really translates to start slow when you're running and then also, of course, allow for some amount of cool down. Would these stretches be after that or even before you run, or primarily afterwards?
I'll tell you what, I played Division I soccer and I never stretched once before ever playing. And I had almost zero injuries. The research doesn't actually indicate that stretching afterwards or before is really going to have much of an impact. But in terms of, getting that blood flow to the tissue and a warm up, a much smaller dose of whatever run you're going to be doing, taking a moment to relax 5 minutes in between that and then moving forward, there is some research that supports those types of things. The big stretching that I would really make sure that you're doing, like people just have this concept that they have to stretch following any type of.
Well, we've been beating it into their skulls for 60 years.
Yeah. They have to, and there isn't a ton of research that indicates that even directly after doing these things, that stretching is going to have much of an impact. It's when you're tight later. Okay. Providing a different input to the system, to your brain, to the tissue, that allows those muscles to relax. It's a positive input that'll allows that muscle to relax, allows the nervous system to relax. So it's something that, a lot of times you can get more benefit from those stretches by breaking up that tightness that occurs after the run, 60 minutes and out, 2 hours later, right in the morning, those types of things, so that you're not creating, that those first couple steps after a long training,
Yeah, especially in the morning, it'd be a really good time to do it.
Yeah. Now that does not mean that, you cannot stretch right afterwards. It also does not mean that you cannot stretch right before your run. Those are all still appropriate. They're not going to hurt you. But in regards to like what we really recommend, it's okay, once you've tightened up, then get that input in there on a regular basis and try to find some consistency with it. So, if you're training for long runs, you should also be incorporating, let's say you run in the morning, you should be incorporating a couple stretches, at 11 o'clock in the afternoon or in the morning, then, 3 o'clock, and then before you go to bed. So that becomes part of your training process, if that makes sense.
I love that answer because I try to get out there and start running as quickly as I can. So, a mile in, I'm still saying, am I doing this? rather than getting to the point where I'm just thinking about it with the stretches, because it's almost like it's too easy to just stop right then. It's like the treadmill. That button is right there that I can hit stop at any point versus, if I run 8 miles away from my house, I got to get back somehow.
Yep. Somehow.
So, no, I actually am very happy to hear you guys say that because, when I'm sitting at my desk after I've done a run, that gives you, something else that you can be doing to help your training. And as well as just from a time management standpoint, when you're doing your run, it's the run.
Yeah. Especially when you're doing marathon training stuff, that's a lot of time consuming stuff.
Right, for sure. Continuing to work our way down, hamstring and quads, I would assume would be next. I know I've dealt with some hamstring issues here and there that luckily I've been able to just work through and usually would loosen up while I was running. But what are some things to watch out for around those areas?
Yeah, so I think kind of first of all, when you're talking about identifying what is good and what is bad, from here on out, it kind of goes along that same pattern, right? What do you feel like not 20 minutes after your run? What do you feel like, obviously, several hours, an hour later? So you're looking for those types of signs and symptoms of, did you do too much? If you're having sharp pains, difficulty while actually running, you need to stop.
Yeah.
At the end of the day, there's a difference between getting up, being stiff, going for that run and slowly loosening up after 5-10 minutes versus, hey, I'm starting to actually experience like a sharp pain, nagging pain that isn't going away. So anytime that you're and for people who are runners, you kind of have an idea of, okay, yeah, I'm a little achy. Yeah, there's a little bit of discomfort here, but I've experienced this before, and
it'll work
itself out after I get going. But when you start experiencing something new, take a step back, walk for a bit, get back, maybe walk for 5 minutes, start at a slower pace again, see if it returns. If it returns, then you're probably done for the session, and then just come back, ice, because who knows if there is at some point, some kind of inflammatory response. Most likely there isn't a structural damage, but it would be more of a tendonitis type of issue. But
and where would you feel a tendonitis issue for the hamstring?
You're going to feel it in two different places. You're either going to see it really up high, right at where basically your sit bones are.
Yeah, you might confuse it with your pain in your butt.
Yeah, or right behind the knee. And there's
that'll be more obvious, obviously.
Yeah, and there's the hamstring actually consists of 3 different muscles. So there's several tendons on the inside and a tendon on the outside, and so that's when there could be pain on both inside or outside of the knee. In other words, like the medial or lateral. That doesn't help people.
No, the inside or out. So the medial is like the part where your knees are touching the inside of your knees, and then the lateral is the outside.
Yeah. So it could be anywhere through those areas. But then, what I usually tell people is most hamstring injuries really aren't truly hamstring injuries, which people kind of look at me like I've got 3 heads when I say that. Most chronic hamstring injuries are more of a sciatic nerve irritation. So there are some nerve glides that you can obviously do some hamstring stretches, but then there are also some nerve glides that you can do that can actually free up the sciatic nerve that runs along that whole same track. And those glides actually will have
they really actually look like a hamstring
they
stretch.
look like a hamstring stretch with just a little bit of deviation to it, and we can certainly send you a pic of those if you needed to post that on your on any of your social media stuff for this. But those can be very effective for it. Most of the time, hamstring injuries, unless there's like a significant amount of bruising or all of a sudden swelling that occurs, it a lot of times is either going to be that tendonitis or the sciatic nerve irritation. So that's always something to be.
And the sciatic nerve will be the way to tell the two apart is because the tendonitis will be point. It'll be either of those two spots. It'll be in your butt or it'll be down by your knee. The sciatic nerve issue could be
A lot of times it's more in the muscle belly.
Yeah.
So differentiating those two things can be challenging, but the good news is you're not going to hurt either one by treating both. And they're both very similar. So it's just important to put the little tweak in with the hamstring or with the sciatic nerve stretch. As far as the quadricep, most people are going to have pain really more or less right above the kneecap.
Or right under the kneecap,
well, for the patella tendonitis. So there's quadricep tendonitis, and then there's patella tendonitis, and really the difference between those two things is one is above, one is below the kneecap. Those are really what I found is that the patellar tendonitis is more painful than the quadricep.
I've had the patellar tendonitis, and
and it's more common. And it's just the way that the mechanics of the knee actually work, because of how the kneecap is pulled, actually pulling across.
The function of everything.
So there's a lot of compression that's placed on that anterior knee during the repetitive jogging and running, especially when you start to get going up into hills and things of that nature. But ice, gentle gentle quad stretches for that. That usually isn't nearly as much of a nerve issue as the hamstring is. So that's going to be more musculoskeletal, or those tendonitis.
And ice works really good for that sort of stuff because it's right there.
Yep. But again, same rules apply. How are you feeling 20 minutes after your session? And a lot of times, I will say this, that if you are having some of these tendonitis type issues that, kind of going back on what I said earlier, a little bit of stretching before probably is beneficial so that you don't irritate it right away.
Even like the active stretching is kind of like what you were talking about I think the best way to do it, to kind of get some blood flow in the area.
Mm-hmm. Mm-hmm. Yeah, absolutely. So that kind of covers the quad, hamstrings. I guess the next section would be probably just general knee pain, right?
Mm-hmm. Right.
This is a little bit more tricky.
That is way tricky.
And just because it
could be 90 different things.
Yeah, it really could.
It could be all of those things.
This is going to be something where you probably need a little bit more rest. Typically when you're talking about actual knee pain, joint pain, it's going to feel deeper.
Yeah, it'll feel inside the joint. Everything else will be, the way I always kind of describe it is like, can you touch it? Like if it's muscular, you can touch it, you can kind of manipulate the pain. Where if it's pain that is like this kind of pain, you can't access it. You can't get to it.
Yeah. This would be something where a lot of ice, a lot of rest, and watch when you're training for something like this, or when you're training to try to avoid pain with this, you want to train on flatter surfaces. That pounding of going down a hill, or the little bit more joint pressure that you get in the joint going up a hill is going to be more problematic. And you might be able to differentiate, whether or not it's more, patella tendonitis, quad tendonitis, versus kind of a deep pain do you also have pain, twisting, do you have more pain when you are doing more of a hilly type of terrain versus a a flatter surface. Those are types of things that sometimes can differentiate whether or not it is something that's a little bit more structurally inside that's irritated. But this is the same thing. It's more of an irritation. Most likely just a general running isn't going to all of a sudden, quote unquote, and I don't mean to use bad terminology here, but tear up your knee. It's just that the tissue inside has had enough, and it's basically saying, hey, knock it off. And so that's where the rest comes in, which is challenging for
a runner.
Runner. And so
and going back to the original knee brace, the knee sleeve you're looking at, a knee sleeve for this kind of injury is not necessarily a bad idea because it'll help keep some of the swelling out.
Yeah. And so, part of the thing that is challenging for individuals is when they do have to start to pull back on some of their exercises or their routine, their training regimen, is that, the question is, okay, well, now I'm feeling a little bit better. How do I then progress that? Or how do I get back into my training? Let's say you took 2 weeks off. Well, most people want to then jump right back to where they were from that stopping point, where it doesn't mean that you have to start from the beginning, but you need to start systematically starting to load the joint, get it tolerant and resilient to those types of strains again, and then slowly expand off of that. So, not to say that it can set you back months and months, but it may set you back several weeks. And that's important, that when you're training for these types of things, that this may be just where you're at from a physicality standpoint, that you've got to just kind of be realistic with yourself, and say, okay, well, my body's telling me this, I can't push through this. Otherwise it's going to continue to get irritated,
And I imagine that something else to make sure people do, again, learn from my mistakes, is the shoes that you wear probably would impact, no pun intended, how well your knees do. For example, when I did that first marathon where I just felt really bad and had knee issues, I had like a pair of off the rack shoes. I think I wore them through the entire training, which is the shoes are gone. They're worn out at that point. Versus the next time I bought a couple different pairs, I would rotate them. They were much better quality. Do you guys subscribe to the same thing as far as make sure you don't cheap out on the equipment?
Yeah. The first thing I would say is tie your shoes.
Yeah, right. I agree.
I feel like we don't need to tell people that, but I mean, we had to tell you, and you're educated. Yeah. And yet you still didn't do it. So
no, actually, I still run. I'm wearing my running shoes right now that are never ever tied. Anyways,
yeah, I can attest. This is
yeah, there are certain challenges when we say, okay, get a quality running shoe, because everybody's feet are
different,
so different.
Mm-hmm. Right.
But you're absolutely correct. When you find the right fit for your shoe, you should be buying a higher quality shoe that has, like I remember a few years ago, I actually went I was running so much that I was like, okay, well, I'm buying so many different shoes, and we had our second child, and I was like, well, geez, I'm just, you know what, I'm just going cheap with this, and I'm buying, a $40 shoe that nobody wants off the, in these discount stores. And I could tell the difference right off the bat. There isn't usually as much of a cushion. There wasn't as good of an arch support. It actually wasn't flexing in the right places. So, I mean, when you're looking at shoes, there are a couple shoe stores that we actually have in town here that will actually let you go run around the block. I would look to see if you can try a shoe.
Yeah, most cities will have that, where there's an actual dedicated running store where they'll let you go out for a run in the shoes.
Mm-hmm. But absolutely to get into specific recommendations, knowing that everybody's got different shaped feet, it's really hard for us to kind of pinpoint that. But it is one of those things that the higher quality shoe, changing your shoes out. Yes, absolutely recommended.
Yeah.
You're absolutely
and I think
correct.
you hit the good one with the arch support. That's an underrated one.
Yeah.
Mm-hmm.
Yeah, absolutely. But I don't know if I have a ton more to comment on that, just secondary to the fact that everybody's so stinking different.
Sure.
Yeah.
Well, and changing them out. Yeah.
That
would be my experience.
Yeah, that's a good one. If you don't have it, some percent, like I have a Garmin watch, and you can plug in when you get new equipment, and it'll log the miles that equipment gets. And then it'll tell you, oh, it's time to change your shoes. And that's kind of nice because sometimes, I don't run long distances, I would always just run, like 3, 4 miles, 5 miles. And so I run in when I did run, in more of a thinner, like not necessarily all the way minimalist, but it was no cushion in my shoes because it's just, that's the way I worked my way down to it. And I don't suggest going on doing that, but I feel like I have more control, if that makes any sort of sense. And it was with that one, it's hard to tell when those shoes specifically are down, because with the Christian shoes, you can kind of look at the outside and, it looks like a marshmallow has been squished. So it's time to change those out.
Yep, to move on. Yeah. Right. I definitely have no background with the minimalist shoes. I know people that get down to that point do like them, and like you said, definitely not for these types of long distances that we're running with. So, but I would not venture any recommendation for those.
Well, I was running a race. It was at midday during June. So it was at 5 o'clock in the afternoon. It was awful. 5 o'clock in the afternoon in June. It was hotter than hot. It was a road race, and it was so hot that the tar was bubbling. There was a guy who was a 65-year-old man who was wearing nothing but shorts. And when I say nothing but shorts, I mean no shirt, no shoes, nothing. And he was running on that tar. And
wow.
It's like, what's wrong with you?
Not to alienate anybody.
No, but that was, we actually know a guy who barefoot runs.
Yeah, and he's nuts, though.
Yeah, he's absolutely nuts.
We like him.
Yeah, but he is crazy.
Even for me on the beach doing that, I maybe 2 miles, and that's about it.
Beach full stop is just hard.
I know.
So continuing down, and I'll be a little selfish with the next couple because these are the injuries that tend to nag me the most.
Sure.
And also, like I mentioned, you guys had just done an episode on shin splints. So for anybody that's interested in listening to your guys' episodes, I would definitely encourage to go take a listen to that, and maybe we can come back to it. Knock on wood, I have not really ever had any shin splints issues. I've known plenty of people that have. But for me, I will describe the pain in my heel. I assume that's where like the Achilles would attach to the very bottom of your foot, but I have definitely had in the past really sharp pains there that would go away after a mile or two, just getting through it. And then throughout the day, similar to what you guys are describing with other injuries, just sharp pain when you first get up.
Is it worse in the morning?
Yeah, when you first would get up, yep, I would feel it before I got a chance to start moving, and then just for the long period sitting at my desk when I'd first get up to go to the bathroom or something like that.
We can tell you what that is.
Yeah.
Okay.
So there's, honestly, it's twofold. There's plantar fasciitis where it attaches to the base of the bottom of the heel. And then there's also the Achilles, which is at the base of the heel. And those two attachment points are actually very, very closely oriented to one another. And typically what happens is that whole area gets inflamed. So like when you're talking about hurting directly in the morning, a lot of times what happens is when we're sleeping at night, most people sleep with their toes pointed. So
because
it shortens.
Yeah, because if you imagine a way you're either sleeping on your back or your sides, or you're weird like me and sleep in your stomach. No matter how you do it, generally your foot falls down, right? So you're pointing them down. So that just
that naturally shortens all the tissue in there. And so then when we go to initially take a step or move the ankle early in the morning, we have an initial strain or stress on that tissue, which causes you to have pain. Same thing with when you're static during the day at your desk, et cetera. Those things are typically put into a little bit more of a shortened position, or they're just not moved enough. And so then you again have that initial pain that you experience. And then of course, when you are beginning your running, what are you doing? You're pounding right on that area. So, what ends up happening is it does turn into a repetitive stress syndrome. They are challenging because, when we think about it, right?
You can't not use your feet.
Yeah. Unless you start to go non-weight bearing and get on crutches or
which
something.
is not a good choice for that either.
Yeah. It's not a good choice. So you're constantly kind of, having that repetitive strain through that tissue. So, right away, what I tell people, you have to get on a schedule with icing. Okay, absolutely get on a schedule with ice.
Yeah. So if you're at work, you can chuck some ice in the freezer at work if you can, and then midday ice it throughout the day.
Yeah. And then you can do a series of different like calf stretches where, a lot of people don't realize that there's two sets of muscles with the calf. There's the gastrocnemius. Thank you.
Soleus.
And then the soleus. So, you can do like what we would consider like a stair stretch, which would be to just let the heels hang off the edge of the stair. And you can do that with the knees straight and the knees bent. That's going to stretch those two different muscles. When you're doing it with the knees bent, which is usually where
that's usually where the problem is. Usually,
yeah, it's usually in the soleus muscle. You're going to feel a very much lower and almost deeper stretch, and that will help that kind of lower portion of the muscle to stretch out, so it's not creating as much strain on the Achilles. And then, if you really try to get everything to relax back. When you're on those stairs, you can actually feel that you get a stretch just kind of on the underside of your foot, right where that plantar fascia is. And so that would be just a very easy stretch that you can do. There's certainly a lot of other stretches where you can do a calf stretch against the wall with the bent knee.
Yeah, there are 10 billion calf stretches.
Yeah, but then the other thing that I recommend for most people is you really in the morning, before you even put your foot down, get a belt, wrap it around your toes and get a good stretch with the knee straight and the knee bent on that calf again, so that you can stretch that tissue out, so that first initial kind of motion and weight bearing that you have during the morning isn't a negative impact on the tissue. So you're essentially not starting the whole inflammatory response off right away. And so if you can avoid that, then that can kind of set your day up for a little bit better success. And then the last thing is really that, and you've probably seen this before being a runner, the tennis ball stretch, again, doing that, kind of rolling the tennis ball 30, 45 seconds on the bottom of your foot. You can do that or
even a frozen water bottle too.
Frozen water bottle, but doing that directly in the morning again, so that tissue is lengthened before you initially put that weight down and go from this 8 hours of really shortened position of the tissue to all of a sudden stretching it out with,
going through all the range of motions with all your body weight on it. Yeah.
Yeah. So avoiding those initial impacts and avoiding those moments where you have pain is really the big thing. And that kind of goes back to like, we offer consultations, wellness consultations where we look and we chat with people about, okay, specifically unique to you, when are you having those symptoms? And then we really problem solve, okay, well, how can we avoid those and modify that? Because if you can avoid some of those pain, that's really the quickest way to get some of that irritation down. Okay. It's kind of sounds stupid. And
the funny part is it's like, you have to be outside of yourself. Like sometimes you're just doing like your normal routine, like you're doing,
we're creatures of habit.
Yeah. And it's hard to pay attention to. You just kind of need somebody who's
objectively
outside,
look at it
and like kind of walk you through, well, what is this? And then we also kind of know where the little triggers are, like, is it worse in the morning, kind of things.
Mm-hmm. But so that's how we would take someone through that. So, and then eventually you can do a little bit of strengthening for some of the intrinsic muscles in the foot.
What are intrinsic muscles?
The small little itty bitty muscles in between all the,
toesies and
all the bones in the foot. And then finally working on some calf strengthening and things like that. But that's after, the pain has been reduced and you can kind of move on with that. But I don't know. That's kind of an overview of that. Questions with that, Greg?
No, that's really helpful. I mean, the stretching before I get up is certainly something that I can add to my regimen.
Because you have to wake up early enough to do it?
Or to beat the kids up.
Well, I guess as long as I have it right next to the bed, I should be good. And actually, luckily for me, I work from home, so icing the foot actually will be less awkward I'm doing that than being in an office space. So employing those couple of things, I think, will definitely help. And then I just, for myself, like I said, watch it really close as far as when I'm running, and if it is noticeably still in pain, after a mile or two, then maybe I'll seek more counsel. or
go for, and again, if it's noticing more in pain after a mile or two, walk for 5 minutes, give it a break, and then jump back into it and see if the pain still is there. If then it's still there, then you've got to either take a break for the day, take a break for a couple days, or start seeking more counsel.
Yeah.
Maybe that is a good transition over to triathlons. Like I mentioned, I had an episode, and I've always eyed triathlons just as a new challenge. And also, as you're getting older, everybody points to running to be one of the worst things for your joints, and eventually your body will break down. So hey, swimming should be something that can be less of an issue there, as well as biking. Two questions. Do you guys see the similar type of injuries or other injuries to look out for when people are doing swimming and biking? And then maybe even taking that back to running, is that an alternative for especially those foot injuries we're talking about? Can you move over to the bike for some amount of time and presumably wouldn't irritate your foot, but you're still getting some amount of exercise in?
Yeah, I mean, I think right away just
being off of the foot.
Yeah, I think when you're dealing with people who are like real hardcore triathletes and training for triathlons, I think you actually find that they don't have as many aches and pains because there is that cross training. It's just, you're not training every.
They're following their ABCs. Always be cross training.
Yeah, you're not doing the same repetitive stress. You're still getting, that cardio in different ways, and you're still training every maybe 2, 3, 4, 5, 6 times a week, whatever it is. But you're not creating that repetitive strain on the same tissues. So if you are a runner and you're trying not to, and you're having leg pain, foot pain, etc. Start trying to throw in a day on the recumbent bicycle, or if you do actually have a road bike, go out and do that road bike.
Or if you can't swim, go ahead and swim.
Yeah, but obviously
swimming might make it worse just because not worse, but it might not help it just because your foot's always in that pointed position. So
we'll agree to disagree on that one.
I'm not saying it's going to hurt it. I'm just saying.
We'll agree to disagree on that one. What I would say is obviously if like my dad swims every single day. He has for the last 35 years. He has not had an issue in his shoulders or anything.
But that would be the problem area would be the shoulders.
Yes. So anytime that you do the same thing, and that's surprising, by the way.
It is unique to him.
Anytime that you're doing the same thing over and over and over again, you run the risk of whatever joint you're actually working or putting the most strain or stress through, you're running the risk of, injuring that. For bike training, the big thing is probably low back, especially when you first get on it because you're much more in that flex position. So that's something that we see with people who I've seen over the years, many people who don't do their road bike, during the winter and then come in and all of a sudden in the spring when they start doing their weekly or weekend type of riding, that all of a sudden they have these low back pain symptoms, sciatica, all that kind of fun stuff. And, then we start talking to them about their back positioning and so on and so forth, because you're stuck in that forward bent position. So, but to answer your question, triathletes in general tend to not, when they are really cross training, tend to not have as many issues. It's when they get kind of pigeonholed into whatever, whether it's biking, swimming, if they do that repetitively, then it's going to overstrain the shoulders in terms of the swimming, and it's going to overstrain the back and the hips when biking, and then really the lower legs when running too much.
That's good to hear. So at least that'll validate my plan of I'm going to see what I can do for the Boston time. If I don't make it, then I probably will switch somewhat permanently to the cross training method.
I can't do it 1, I do it 3.
Yeah, I know. This extra 5 minutes that they took off too is it's making me very sad at the moment. So that is definitely the plan for all the reasons you guys just mentioned as far as the cross training is concerned. Hopefully it'll keep me out there longer and I'm not just on the couch with injuries over and over again from doing one repetitive thing. I had one other question that I just thought of as far as equipment is concerned. Whenever I'm at the races, it seems like more and more people have the tape on either their arms or on their, I think mostly on their quads or hamstrings. I've never really looked into the purpose of that. What is the intent of that?
Good question.
Okay. So, and the question is, how deep do you want to dive with this? All right.
There's a quick and dirty answer, and then there's a, well.
So the intent behind it. The intent is actually so there's several different layers of skin, muscle, etc. Right? The intent is actually to
theoretically,
yes. Let's put that
simulate
in theory.
That in.
The theory is that you're moving that superficial epidermis layer, your skin, over the muscular layer, and then those things slide and glide over each other.
So if you were
more
to feel,
smoothly,
if you were to feel the top of your hand, and you can move your skin around, right? That's what you want. You know, all the layers moving separated from each other. This theoretically facilitates that better.
Yeah, and creates more range of motion, decreased tone in the muscles, etc. The other major theory behind it is if you look at any kind of muscle or any kind of drawing, right, and these are actually fairly accurate, you can see that there are muscle fibers that when you get into the details of the drawings or pictures, there are certain directions that each muscle fiber is going to go. If you get like a good tape, a good pull along, like parallel with a muscle, okay,
especially that tape is kind of stretchy,
then the idea is that that's actually going to facilitate more contraction in that area. And then on the opposite of that, if you're looking to say you've got a muscle that's firing too much, on the opposite side of that is if you put them perpendicular to those muscle fibers, then that will actually inhibit the muscle contraction.
Stop it from contracting as much.
Yes. See how he just fills in all the
dumbs it down very quickly for me. That's perfect.
And so there's more validity to the second part of that. Okay. The specifically inhibiting muscles. The facilitating of muscles is somewhat sketchy.
Dubious at best.
Yeah, it's the research isn't quite out
and
on
when you
that.
know if you that's what you're going to see mostly at the races is people that are taping themselves to facilitate the muscle to work better.
Yeah, but then when you actually look at the first theory behind kind of making that skin move over that lower layer of tissue, that one really is pretty dicey. That the research doesn't hold up on that. In the end, people swear by it, and if that's the case, go for it.
Yeah.
If there's a placebo effect, meaning that there is no actual physiological effect,
but it makes you feel better, then it works.
And it's more psychosomatic. Great. Whatever. At the end of the day, we joke around all the time with our patients, with ourselves, that we don't care how you get better, whether it's all in your head, whether it's not in your head, whether it's something physiologically that's actually going on, as long as you are moving forward and able to continue to put one foot in front of the other from a running standpoint, from a walking standpoint, whatever it is, if you're actually moving forward within your symptoms, then it doesn't matter. Okay. If you want to try it and see what happens, go for it.
It's definitely not going to hurt you.
Yeah, and that's a great point. It's not going to hurt you. It becomes
it'll hurt if you're a man and you have a lot of hair.
Well, but it becomes costly it does become costly if you're not like that. K-tape is not cheap.
Yeah, it is expensive.
It's not cheap.
Yeah.
So if you are training a lot and doing it daily, that can become very expensive. But it's not something. It's never my go-to. I mean, it's kind of like if we're working with patients on this type of thing, it is pretty much the last thing in the bag that I would maybe say, you know what, we're not getting anywhere. Let's try this, and if that helps, then that helps.
Yeah.
Unless someone's bringing it up.
Okay, good. Well, that's something that I'll probably keep to the side for myself, unless, like you said, I need some sort of a placebo effect when race day comes. But you don't want to go and do anything too different from race day versus any of your training. So that expense may become a consideration.
Yeah, absolutely.
Well, that's all the questions that I had. Anything that came to mind from your guys' standpoint that we didn't cover?
Gosh, I don't know. I think we rambled a lot.
Look at the wing stuff.
Oh, I'm sorry. I rambled a lot.
Yeah, because you guys can't. You're good. You got it.
I think the big thing is just listen to your body.
Pay attention to the small things that you don't think that are causing the pain, because generally the things that is causing the pain isn't the thing that's right then. It's usually you're causing the pain, and then the pain happens afterwards.
Yeah.
And people tend to not associate those two things.
Yeah.
They'll think of the thing that they're doing immediately. They're like, nothing. I wasn't doing anything. I was just sitting on the couch.
Yeah. There's actually research that indicates that pain can come on up to 14 days after an incident, which is really, really discouraging for people because most people want to have this cause-effect relationship. And, the analogy I always use is if you go outside and, stub your toe on the, on the cement, exactly what that problem was. But if it's 3 hours earlier, a day earlier that you actually injured yourself, are you ever going to make that connection? So really look into your past to really start to determine what the cause is and then start to alter that and see how then you can, and do that all at one time, or I'm sorry, just one thing at a time so that you can see how your body responds differently and you can kind of weed through some of that. But
you don't want to, we're also not, at least I am specifically, I don't like giving out a lot of exercises at first, specifically because if you give out 5 or 6 exercises and the person has pain, you don't know what it was that caused it.
Yeah, or if they feel better.
Yeah, what was it?
Helped?
Was it one of them that did it, and then we can just do the one? Is it? I don't know.
Yeah.
Yeah, like the same concept as an elimination diet, right? Like do one thing so you know the thing that's working.
Yeah, absolutely. Yeah, and that's really where we kind of mentioned earlier, we do these wellness consultations, and they're not face-to-face, they're just over the Skype and whatnot. And that's really where we try to weed things out for people and kind of dissect their habitual patterns and where those causes are. And that's where sometimes you need that outside counsel to just, kind of have that objective.
Ask the questions that may not know to ask yourself.
But no, I think just listen to your body is my biggest thing that I tell people all the time. Your body is telling you something. Don't try to just push through it just because you're too tough or, most people who are coming to see us aren't world-class athletes, and if they were at one point, they still aren't now.
No.
So your body's wearing down and you got to pay attention to it. Otherwise you're going to make things worse. So
can you go ahead and give your social media information where people can check out your show and ways to contact you?
You can contact us at DIYTherapy 206@gmail.com. If you have your own things you'd like us to cover, we'd be more than happy to talk about anything. You can find our podcast at DIY Therapy pretty much everywhere.
We're on iTunes.
There are some things I can't access because I don't have a Google phone. So I don't know what, but I know we're on like Stitcher or not Stitcher, but we're on like Castbox. I know we're pretty much anywhere that is on there. You can follow us we have an Instagram account at DIY Therapy 206 where, I'll put up little snippets of our podcast and sometimes like for this sort of thing, like I'll put up, for the nerve glide. I'll usually kind of use that more for our exercises. And then Twitter is just me just being a goofball, really.
Yeah. And then we have DIYtherapy.net,
which is our primary website,
where you can get all of our podcasts. We have,
if you want a wellness consultation, you can sign up for that.
Yeah, we've actually have 3 different self-treatment books, one for chronic pain, one for neck pain, one for low back pain that you can purchase. We have our other products that are on there. And we also have all kinds of different treatment guides and treatment philosophies and YouTube videos on our website also. So all kinds of different stuff that you can kind of access there.
Yep.
Perfect. And I'll be sure, of course, to post some of the links onto the show description once we get this published. So hopefully folks got some information for their own exercise program. So thanks so much for doing this.
Yeah, thanks for having us. Yeah, we really enjoyed it too. So thank you.
Great. Take care. If you enjoyed this episode, please be sure to give us a rating on Apple, Spotify, Stitcher, or wherever you get podcasts. If you'd like to be notified of future weekly shows, please hit the subscribe button. Thank you. Suburban Folk is now part of the Pod All the Time podcasting network. Be sure to check out the other podcasts that are part of the group. This podcast is for educational purposes only. It is not designed to diagnose or treat. When beginning any exercise program, it should be reviewed and discussed with your medical professional prior to beginning. Information on this podcast is not designed to replace medical treatment.